Hi folks, today is Tuesday, September 15th, and a few things to share with you today. Unfortunately, first bit is not good news. We had a healthcare staff member from our RiverWoods Exeter Woods Healthcare Center test positive for COVID-19. Today we found out that information, and this staff member works exclusively at the Monadnock Lodge, so the Woods Campus Health Center. We will and are now testing all healthcare residents in that campus, and we'll test all staff who had any interaction with the health center over the past 14 days. We'll test all of those staff today or over the course of the next day or so. So while we await results, unfortunately, that health center will stay quarantined, and the folks who live there will need to stay isolated in their rooms for their own safety. That's not great news, but as we say, knowing is better than not knowing, and we will do everything we can to keep our residents and our staff members safe. A few other things that are sort of on my mind, and just to let you know what we've been working on. New Hampshire's data over the course of the last few months has been pretty good. We've sort of settled down at about 20 or 25 cases per day. Unfortunately, right now that's ticked up to about 34 cases per day over the course of the last 7 days. But our percent of positives, so that we're testing about 3,400 people per day and getting about 34 positives. So by and large, we're running about 1% still, which is good, but not as good as it had been. So we'll continue to watch that as we consider changes here within our campuses. The other things that we have going on, we're as we've said before, science keeps changing, right? So every 4 weeks, there's something going on in science, and we're hearing positive information about potential vaccines, about the distribution of potential vaccines, and about potential therapeutic drugs. In addition to that, we're following up on a few leads. One, in action, we have engaged Train to install UV lights in our health center air handling units to essentially sanitize the air. So more reports are coming out that there's a potential that the virus can be airborne. This gives the opportunity to sort of cleanse that air as it works through our system. I'd like to tell you I understand the science. I don't. I just understand that it works, and it reduces the risk of spread. So we are going to do that in all 5 health centers, so 3 in Exeter and RiverWoods Durham and Manchester. And then the next thing we're looking at is something we've read about that colleges are doing, which is essentially testing the human waste that comes out of a building. So that you go to the main output pipe. I don't know exactly how this works either, but the virus sheds in our waste, and so you can mass test. If the virus shows up in that testing, then you have to do more testing to try to identify who might be infected. But if it doesn't show up, then that population of people is clean. So we're looking into that and have more information over the next couple of weeks. So what I really want to say today is there's nothing we won't do to keep you safe and to keep our staff safe. And what we ask you to do is simple, and it's what we've been saying for months now. Wear your mask. Stay 6 feet apart. Keep your social circle small. Don't be near people who you don't know where they've been, and wash your hands at every opportunity. That's what we say to you, our residents. That's what we say to our staff. And I think we can all do this, but we're going to have to hang in there for a little while longer. Science is coming, but we got to give it a little time to catch up. So it's been lovely to not be making videos every day because we didn't have a lot going on for the last few months. But we will be back with you, as soon as we have additional information about our RiverWoods Exeter Woods Campus Health Center testing. We'll keep you apprised as we go forward. Until then, Wash your hands and stay safe. Thanks.